Polk County Health and Human Services Board. I will ask for a roll call.
So Francis here. John Bonaprise,
Here.
Brad Olson,
Here.
Pam Darby,
Here.
Tony Johnson, Willem Oliva,
Here.
Rita McKee, A. Magnifici,
Here.
and Dr. Rebecca Lyman. Here.
Okay, with that, we have roll call. We do have a public hearing this morning on some ordinance changes. We also have a supervisor here who would like to address or have some comments on that. What would be the best way, do you recommend that we launch into that during the public hearing, or supervisors not seated, or as we go through it a little bit?
Public hearing is usually an opportunity for the public to voice their concerns. I don't know that we have any public. If the chair wanted to recognize a other board member, I suppose they certainly could during the public hearing. Otherwise, you could open the public hearing, close the public hearing because there's no public present to give comment, and then allow the supervisors to either engage in the discussion. You as the chair have the opportunity to call on supervisors not seated, or they could give any specific information they want to give during number 7, receipt of information. So there's a couple of different options. I don't know that there's any particular better way to do it. It's dependent on how the chair wants to allow non-seated
Sure.
to engage in the conversation.
And I have no issues, Jim, if you want to just chime in when you have some comments. Actually, though, if you could sit somewhere where I can see you a little better, then it'd be easier for me to recognize you from over there. So, okay, with that, I would look for a motion to open the public hearing regarding ordinance changes on Chapter 16, Articles 1 and 2, and Chapter 22, Articles 1 and 2.
It's Chapter 16, Articles 1 and 3, I think. We're
Oh,
not
I beg your
addressing
pardon.
two of Chapter 16.
Okay, Chapter 16, Articles 1 and 3. I stand corrected. And Chapter 22, Articles 1 and 2. And with that, we have some staff that would like to give us some background information on this process and how we got to this point.
During the public hearing, and then you'll close it, or?
Well, since we don't have any public here, can I close it or do I have to leave it open 15 minutes?
I think if we give a background, talk about how we got here, talk about what the changes are, just a brief overview of those. And then at the end of that, to make any comment.
All right.
That should probably run us to 9:15 anyway.
We'll just do a brief overview. So we got to where we are. We've got the resolution copy. If anybody needs to pick up a copy, it's up by the county clerk. So I think it was probably a year when it was ordinance update season. So that asked us if we had any ordinances that we wanted to update. I believe that intent at the time was to do these ordinance updates, and then
I apologize, Fran. Did
Yes.
you have a motion in a second and go into the public hearing?
You know, I don't believe we did. I asked for one, but I didn't get one. So I'd like to entertain a motion.
move.
Okay.
second.
And second, any discussion? I'll call for. Aye.
Aye.
Opposed, same sign. Motion carries. Okay, thank you.
So ordinance update season ago, we recognized that there was some cleanup that we did in the areas that we're talking about today. Chapter 16, 1 and 3, and also Chapter 22, Articles 1 and 2. The meat of it really is in the struggles that the health department has had over the years in the chapter 22, the public nuisance piece, primarily around enforcement or lack of our ability to enforce just as a manpower issue. So we really didn't have stuff in place to be able to enforce. Historically, nuisance theme is somewhat of a precursor to the human health hazard. Human health hazard exists when the public nuisance was written, and there's crossover in between the two where human health hazard is domain and responsibility. We are set up to enforce that. We do enforce that. It's where the cleanup come into play. And then through one of the committees, the smoke-free air ordinance came up as, that the committee would take a look at it and bring back changes to us. We also took a look at it, just made a few minor changes, probably more grammatical, and to incorporate some of the vaping that people are doing now. So that is the snapshot of how we got to where we are today.
I think just to clarify, was brought to my attention from the health staff is that often the public calls with a concern and they have pulled up the chapter 22 nuisance and they're reporting the concerns to us. And we say, yep, you're heard. However, that needs to be reported to zoning or that needs to be reported to DNR. So it's causing frustrations on the end because they're citing chapter 22, but it's not written in a way that's easily enforceable, actionable from us. So confusing from the public end and then also redundancy on the staff as we're fielding these calls, trying to explain it and then getting us in the right direction.
Okay, thank you, Helen, for that. And Tanya. And we don't have any members of the public here. It's not quite 9:15 yet. I don't know, can we close this or we better stay open till 9:15?
So it's not specifically agended from 9 to 9:15. It states that it'll start at 9. 15 minutes is the amount of time to give the public an opportunity to be a little bit late, but there is no
Okay.
specific obligation that you keep the public hearing open until 9:15.
Do we have anybody online that is here for public comment, public hearing? Is that Rita?
I'm online, but I'm not public. I mean, good morning.
I can't read. That's too far away from me. I can't even read those names. It usually is mostly staff. But I just wanted to throw that out there. So there were
Staff members that I can see.
Four?
Staff, and then there's 4 board members.
4 staff and 4 board. Okay.
4 committee members.
Okay. Okay. Well, let's give it a few more minutes in case somebody had, as unlikely as it is, if somebody had some bad roads or something. Well, I'll give them another 5 minutes.
Okay.
And with that, if we can talk amongst ourselves.
Can we ask questions?
Madam Chair, can you hear me?
Yes. Hi, John.
On this changes, is there any deletions or is there just additions?
So this is the same markup copy that we approved at our prior meetings to send to a public hearing. So the documents that are here today are redlined and reflect the changes that were made before. There are no changes that have not gone before the committee and that the committee has not approved.
Okay, thank you very much.
You betcha.
My question is just, how does it, for chapter 12 under environment, the first page of that chapter is smoke-free thing. How is that gonna, does this affect it?
So
You don't have it in there. It's a whole different chapter that it's overlapping.
so it's Article 3,
Oh, you have to go to chapter 12.
Chapter,
Chapter 12.
Attorney Loso is going to chapter 12.
he's gonna look it up.
Yeah.
Okay.
We have just.
Because it's a completely different one.
Oh,
It has,
we don't have 12, do we?
You
No,
guys don't have it.
Okay.
so it was kind of a different,
12,
Haven't-
unsmoking in and on county property prohibited.
yeah. So do these intertwined or do you put both those together so it's not in two places?
So what is chapter 12 as far as what is the title of chapter 12?
Environment?
Environment.
Just general?
No, it's in two articles.
So,
So chapter 12 is I can state. Chapter 12 is just smoking,
on county property,
yes.
so.
That's been done by facilities and environmental, or not environmental, but Rod's division,
Okay,
correct, Mo?
so I don't believe we've taken a look at that because that's not within our purvey to,
So they post the smoking signs, they,
It would be two different ordinances then that would overlap.
So they don't necessarily overlap, Kim. What I can say is section 12:1 talks about smoking specifically on county property, which is specific to either county buildings or, really
But it does do the fairgrounds and stuff. So I mean,
where
would it not be good to take that page and maybe incorporate it into one?
I don't know that it necessarily contradicts anything in this
Okay.
particular change. It's more of this is for general public application for tobacco use, where this is just narrowing it down to only on county property. It also gives two different enforcement abilities for two different agencies to enforce similar restrictions, just in different ways.
Okay.
I don't believe they're conflicting.
Okay.
They
Well,
may
that was-
play along with each other, but
When you have it in two places, it's just kind of like, now we're gonna make a bigger mess.
I would say it's similar to
What else
having
you
a
got?
speeding citation and a reckless driving, right? You can get both at the same time.
Okay,
Speeding, if you're going fast enough, you could be reckless driving. Similarly, you could be smoking in a public place, a county building, so you're smoking in a public place and you're smoking in a county building, so you could be violating two different
And
ordinances.
we do not have a smoke-free campus policy here. There's on designated areas, they can away from building entrances. But to have a smoke-free campus would be a lot of monitoring because it's the public and the staff.
It just says in the buildings
yeah, it just says in building.
inside.
By any,
or in county vehicles, by any.
Okay,
Well, thanks for clarifying that first, Joe. Appreciate that. Um,
and the other one, when you did the 4225 nuisance one, is that the one you're fixing up from when you did all this? To clarify that when she said that, that's your new clarifications, wasn't it?
yep, the back,
Back pages of this. Okay, so this old one is incorporated in.
basically a strike.
And just to clarify, I mean, some of the things in 221 went into zoning because some of them were zoning things and some were, but yes, the 220, yeah, the
Yep.
crosswalk is there. Just to clarify that, yes, you kind of pulled off the stuff that we thought was directed, that was helping
We
you.
put everything,
Services and then zoning.
So that was the start.
That was the start, correct?
All right, thank you.
We actually, just a little bit of history of it is we started out with just kind of doing some language cleanup. And then there were others that came up and then it turns out, I believe it was like 40 years or something since it had really been looked at. So then as a committee, the committee designated Pam to start out working with our health department officials and employees to give us a jumping off point. And then we went through and reviewed the whole chapters and recommended these revisions. So it is now 9:15. So I will entertain a motion then to close the public hearing.
I so move.
Did you second that, Pam?
Sure.
Okay, I heard you, I heard a noise next to me, so I
Perfect.
thought that
Yep.
was you. Okay, motion has been made and seconded to close the public hearing. Any discussion? No discussion. With that, I will call for a vote. All in favor, reply aye, and opposed, same sign.
Aye.
Okay, motion. So with that, we will move on to agenda item number 4, approval of the agenda. So I'll look for a motion to approve the agenda.
Approve the agenda.
Thank you. And a second?
I'll second it.
Okay, seconded by Rita. Any discussion? No, with that, no discussion. I'll call for a vote. All those in favor respond aye and opposed, same sign. Aye.
Aye.
Okay,
Most Fran, just a clarification.
yes.
You really can't say that. You can't say all in favor, aye, opposed, same sign, because you need to like break up the two. Understand? Because if they say aye,
That's a really common practice.
is it? Okay,
Yeah.
sorry. Because for
So-
me, that's confusing. I apologize. That's just, maybe it's just a
What does
question. on-
Robert's Rules of Order say, Joe?
So our rules follow that to an extent. It's all in favor, say aye, and then there's supposed to be a vote, and then all opposed. Our rules say same sign.
Right.
Robert's rules have been updated in the last, I think the last 2 or 3 revisions to say that that's not necessarily the best practice. It is our rule, but Robert's rules say a better practice would be to say all opposed, say no, or something other than
Right.
same sign, because it can become confusing. But again, our rules say same sign. I understand what you're saying.
The
that-
pause.
Right.
It was the pause. That's
Yeah.
all I was questioning, is that if by chance someone did disagree,
And you know
it's
that,
being said in the same time. That's all. Just a point of clarification.
that actually has occurred to me as well.
Okay.
But, since it has same sign, but in any event, we will move on from that.
And that's one of the reasons, same sign. Why would you say aye just at a different
When you
time?
mean-
That's why Robert's rules kind of
Sure.
changed that. Anyway.
Okay. So, in any event, I believe we have the agenda approved.
Yes, we do. Yes, we do.
Okay.
No one was opposed. No.
Nobody was opposed. Okay. So moving on to agenda item number 5, approval of the minutes of the December 9th, 2025 meeting. So I will look for a motion to approve. Move to approve. And a second.
I'll second.
All those in favor respond aye.
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 Opposed, respond nay. Okay, we have no nays. Is there, we didn't have any discussion, so with that, the motion carries. Okay, moving on to agenda item number 6 is public comment. So we don't have any members of the public here to comment, and it appears we don't have any members online to comment. So we will move on to agenda item number 7, which would be receipt of information from supervisors not seated as committee members. We do have Supervisor O'Connell here this morning, and it is determined that he is welcome to chime in throughout our discussions. So as chair, I've approved that. Did you have anything else for us?
No, I just have a few
Okay.
that I marked up.
Okay, and when we get to that way,
Correct.
we'll have you speak on that. Okay, so then we will move into agenda item number 8, which is discussion and possible action regarding ordinance updates. So we'll take item A first, which is chapter 16, articles 1 and 3.
You want to do it the same way we did last time, page by page?
Yeah.
That seemed to work pretty good.
Yeah. We'll do that just kind of for everybody's comfort level. I think we're all familiar with it, but not everybody is. So let's do it that way.
So the red indicates a change. It's either a straight through, or if it is underlined, it means that it was added language. So no changes since the last time we discussed.
Okay, any comments on page 1? Definitions, okay?
Yeah, there is one clarification, Scrivener arrow on the definition of cigarette, statute 139
Okay,
30 subsection 1, it should be subsection 1M.
1M, so that would maybe be a Scrivener's.
Yeah. 1M is cigarette means any roll of tobacco wrapped in paper. Any substance.
Is that Article 3? Is
Yes,
that in Article
we
3?
go in order that it came.
Okay.
I had the page number, that's what I had it.
Yeah, I don't have
If we
page
go
numbers.
by that order, would make a little bit of sense. Who's on it?
Okay, so hold the cigarette thought until to that page. Anything on page, the first page?
Yeah, anything?
I don't think it's on the first page, Mo. Cigarette definition.
What's that definition?
What's the number on that?
We're on 16.1 definitions.
16.1 definition. Please help. You see it?
One that was. I didn't know that was.
Mm.
Six one.
Yeah. I thought it was Article 3.
So we're just doing article.
Wait.
The way it was.
Packet.
Oh, so.
It didn't say.
Oh,
Well, I.
Okay.
In the wrong order.
okay, so you're looking at 1686, Mo?
I was in Article 3 as it was
Yep.
after the minutes. That's.
We're straight now.
Are we all on the same page then?
I think so.
Okay, so we're gonna start out with chapter 16, 16.1 definitions and move through. So do we have anything on that page?
I have, where it says dwellings mean a structure used for housing people. The word housing people we don't use anymore, so it's human habitation. And if you look throughout the document, that's the words that are used, human habitation. So I don't think that definition there is right.
Housing people. Habitation.
Yeah,
So is that something that we can change now if we so deem?
You can change things. The concern, similar to what we saw with Stour, is if you make substantial changes and something requires a public hearing, then it could cause an issue. But because, one, this ordinance change does not require a public hearing, and two, at least so far, this certainly wouldn't be a substantial change to what was already proposed and heard for public hearing. I think you can make at least minor changes without another public hearing regardless. And you only need to worry about that if you, as the chair, in your discretion, want to have an opportunity for the public to be heard again on any substantial change.
Okay, I don't see this as a substantive change between housing people and human habitation. I'm okay with that change. Where, how does the rest of the committee feel here? And do we need to make a motion on that?
Because nothing is officially drafted yet, most of these changes so far have been made by consensus.
Okay,
And so ultimately, when you're all done, what this committee will do is maybe make a motion to direct staff to draft a resolution to bring in front of you for next month or 2 months from now or whenever. That will be the formal action that the committee takes. So if you can all agree on consensus, no one has to move to change anything or anything like that. So
okay.
I think that answers the question.
Looks like everybody is okay with that. So
Okay.
I'm sorry, I couldn't hear you. Is it a,
Thumbs up.
I said-
okay, great.
said, okay.
Okay, next page.
Okay, so let's move on then to the next page, section 16.2. So the proposed change is Article B, which clarifies the city, village, and town ordinances that aren't enforced by the county. Any questions there? Doesn't appear so. So section 16.3 administration. Doesn't appear there's any questions there. So flipping on to the next page, 16.4 is where we begin the human health hazards abatement and maintenance. Okay, so going down to that, section C, number 2, air pollution. That just refers back to the DNR and OSHA regulations and standards. 3 is kind of just some minor wording. 6 is noxious odors was struck. And then we have the addition of the manure fecal matter. Then we go down to 9 on buried carcasses. 10, healthy, unhealthy, or unsanitary. Is determined by the health officer, just kind of, again, some minor changes in wording there. Same thing with number 11. Just some minor wording. And number 12, pretty much same thing. No comments there. Let's go on to the next page, which just, again, at the top of the page is the wastewater, a little bit of the wastewater language. So section 16.5 is housing as human health hazard. That addresses the change of the dwelling not being a weatherproof and infested. As well, do we have anything there?
I'm sorry, I missed. The air pollution, you have 3 standards. Which one would you use? I jumped back to that page. I'm sorry.
So you're looking at number 2,
The first
the
red,
air pollution.
there's 3
Okay.
different standards. Which standard would you use?
I
If
believe,
they're all not the same or whatever, how do you decide which one to use?
well, I don't believe that they are necessarily identical. And that way, if it isn't covered in one place and it's covered in the other, then we can still use whichever one it's in.
So if you say, but what if I say I want to go by OSHA and the other stuff isn't in there? That's what I'm saying. How do you decide which standard to go by if the 3 standards are so different?
I'd
If
refer
I
to,
took one that didn't have what I wanted, say it doesn't have phosphorus in this one.
Mhm.
Okay, and I got phosphorus in my water. Okay, I don't want to use that standard. I want to use this one.
I'd refer to legal advice on that.
Okay.
I think Helen and.
Yeah,
I think it'd be dependent on the situation. Are we talking about groundwater? Are we talking about air? Are we talking inside a building, outside a building? So each of these agencies are very specific on the lanes in which they can comment on standards. So we would take depending on the situation.
And if I may add too, because there was some, and I apologize, I don't remember exactly where we found this language, but there was some description, whether this was on a state website or something that used these 3, because this at least established, and this language was taken from somewhere, and I can't remember exactly where it was, so I apologize. But what it did is it established a measurable amount for air pollution, because before it just said air pollution, if it stinks, and it's like,
Yeah.
we can't
Yeah,
have that.
correct.
So
Yeah.
this was out of, like I said, I want to say it was a state site, but I apologize, I don't remember, but it was like, here's a good definition that says, here we have places where we can measure these things, and here are the standards for them. So that's why all 3 of them were in there.
Yeah, that previously there weren't really any standards other than,
That was in the nuisance one.
Right,
Yeah.
right, other than it stinks.
And then the solid waste, it says improperly stored. Is there something that says properly stored? How do you properly store that? There's something that says.
Well, I think this,
That one?
yes, go ahead.
Because this was definitely one that I was struggling with, in the fact that because of the nuisance ordinance originally, it talked about if we have an issue of something not being used correctly. And it's like, if we take that away, all of a sudden you could have a manure pit that says, hey, this collects flies, but it is being used as it was designed, in August, the summer, you get rats, you get mice, you get whatever. But if it's being used as designed, therefore it should not be considered, something that you can attack as a human health hazard. So that's why, when you have a manure pit, when you have holding tanks, we have whatever, if they're used as they're properly designed, we can't turn around and say, well, they stink and we don't like them. That was where the improperly word came from.
makes sense. Okay, are we good then, moving on? Would appear that way. Okay, we just have again, our search name, tap the next page. So section 16.5 is designation of housing as a human health hazard. So that addresses and, further perhaps defines doors, windows, ice, snow, insects, houses full of garbage type of thing. So, yes.
I had a question about, further down in 16.5 under C, D, and E. We always have designee after health officer. Those paragraphs, does it need to be?
Health or designee, I guess to be uniform, it wouldn't hurt to add that. What's the committee consensus? I don't see any issues with adding or designee, so we're uniform with the rest of the ordinance.
Yeah.
Okay, sounds good. F is really some language cleanup, County Board of Health. So that changes to Polk County Health and Human Services Board. Then,
Is that not
Yes.
BOA or is that? If that's an administrative rule, does it go to BOA? Does it go to the board first? Your board first,
it would go to our board first,
then it would go BOA to the court. Would that be the order, I guess?
person affected.
Adjustment. And then
Yeah, they
The
could,
Administrative rule, the Board of Adjustment.
yeah, so then
So if that would be the order,
that would be the appeal.
yeah, oh, okay.
That's the way that I interpret it. So,
Then on E though, you have, it's allowing a reasonable time for performance. Was anything gonna be done there?
that reasonable time, we discussed that quite a bit. What is a reasonable time and who decides what a reasonable time
Yeah.
is?
Health
Yeah,
officer.
health officer.
health officer, yeah. And I think,
Do we want to give them guidance?
The health
6
officer and
months, 3
then
months,
subsequently
2 days.
my office and then subsequently a court. That's who decides what a reasonable amount of time is.
yeah. And I think the intent too is that, education's better than enforcement, but you can only plead ignorance so much.
Well, a lot of times there's weather conditions that we need to work with.
Yeah.
So I think each situation is going to have its own set of guidance from the health officer.
Yeah, and I believe that was part of our discussion when we did talk about that as well. So if we don't have anything else, I don't want to hurry anybody or hurry anything, just trying to keep things moving along here. So that is 16.5. 16.6 is the enforcement procedures. With the written order, exception to a written order in extreme cases, then again, we have the designee, the abatement or removal refers to the ordinances and the statutes and the procedure for that. Are there any questions on that?
And it's that same time period. Just
Yeah,
To note, yeah, that it's in.
And that-
place.
yeah, it has the same time period in, as determined and what the chain is for that. So if we're good there, we will move on to Article 3, which is our smoke-free air. Had some discussions about this because, there's vaping now. There's, smoke-free, there's, other products are legal that, smoke, CDHB type products. So we had that discussion. You had, I believe your question, Mo, is on the next page, or no, we're not there yet. Okay, so do we have any questions up there? Smoke-free air. Pam?
No, I was gonna say, I think his was on the same page with cigarette. Right. This on the definition of cigarette.
Cigarette needs to be subsection 1M.
1M,
Yes.
okay. So that has been noted, and that's a kind of a Scrivener's error error or correction. So Karen, you got noted that, so we're good there. Okay. And then we will move on to the next page. Rooming house as defined by statute. Smoking prohibited in public places. And that addresses the county parks and the fairground.
We should go back one where definition, tobacco product means any form of tobacco prepared in a manner suitable for smoking, but not including cigarette. Can you make sense of that for me?
Okay.
What is, it's a tobacco
Including,
product, but it isn't. So how,
what's your number you're looking at?
I am looking at definitions. It's the last definition,
Next page.
Okay.
which says tobacco product means.
Tobacco product.
Oh, tobacco product means any form of tobacco, but not including a cigarette. Yeah, I don't know, that's an oversight. perhaps.
Like a cigarette is specifically defined as something else. So
Yeah.
if the use of the word cigarette is used in the ordinance within this particular article, it means cigarette as defined by cigarette. If it uses the word tobacco product anywhere in this particular article, it means things other than a cigarette. So if in this article they want to talk about cigarettes and tobacco products, I would hope that it would be written where it says tobacco products and cigarettes.
Cigarette packs, all the stuff on them. What is the definition of a cigarette then? Is it called a tobacco product in that definition?
So what? It's the state statute.
That was wrong.
The role of tobacco.
That definition, if you look it up, it's wrong. There's no definition of a cigarette there. Is there on 13901? It just
That's where
says the
you-
health department on the end of that.
Then you needed M. M was dropped off. That's where he added the
So then what did
beneficiary of M.
Yeah, okay.
Cigarette means any roll of tobacco wrapped in paper or any substance other than tobacco.
So it's a cigarette, it's a tobacco.
That's what a cigarette is.
So the thing rolled
Pretty
in
well defined.
paper, that's what.
So if it's rolled, it's a cigarette. And if it's not rolled, it's a tobacco product. Would that be a fair assessment?
Well, apparently, anything else other than that is a tobacco product. So even if it is a roll of tobacco wrapped in tobacco, that would be an other tobacco product as defined under
That
our
would be a cigar, yeah.
Yeah.
Okay. But. All right,
Okay, I think we've
it's
clarified
not too confusing, all right.
that. Okay. We're looking at 1687. We didn't have any changes there other than the buildings with the fairgrounds language. Pam?
Yeah, I do have a comment and I apologize because it was an oversight on my part or I didn't even kind of really process it. I'm questioning a little bit if we really want to list ride/game area. Because if you put ride/game area, you are including the entire fairgrounds. Is there a point to have the entire fairground smoke free? I mean, I understand in the barns, in the bathrooms, in the buildings.
It's the ride/game area, the fairway where the carnival goes.
I'm just saying that, but but rides, I mean, people ride horses, people, you know what I mean? As far as I think it's maybe a bit broad and I'll just throw it, I'm not comfortable with that language right now. And I didn't
Carnival
realize,
rides.
huh?
Carnival
Carnival-
Carnival rides.
But even then, I mean,
Because I'm
it's still
thinking-
outside, it's still open air.
Should we make it easy and say smoking in designated areas only?
Then we have to
Enforce it.
post that, right?
You have to enforce it.
And we have to enforce it.
You have to enforce any of this, so it's the same difference, but how do you enforce somebody walking through the fair having a cigarette?
So
They can smoke anywhere. If it's designated areas only, you don't have to name every little spot.
but just to
Here's a
that,
corner, here's a corner, here's a corner. You're done. If you're smoking out of those spots, you get a ticket.
so just to back up before the point slips away. So the ride game area, I would not be surprised if the carnival ride operators don't want people smoking cigarettes riding on their rides and dropping a cigarette that might land on, where there's gas or oil or, anything mechanical. So I think that the ride game area, to me, I can see that there may be perhaps some reason to keep that part of it. And also, their, games, I mean, I don't know, I'm not an expert on, the carnival industry and how everything works. But, definitely I would say with the rides, that they don't want people smoking on the rides.
But if you go to any
I
big
think you're
parks,
exactly right.
any of those, they have smoking designated areas. If you're not in that area, you got a cigarette, you get a ticket. You can't run behind a bush and have a cigarette. You can't go in try to hide next to it, and have one. If you're not in that area, you don't smoke. That's just, it would be simpler, I think, to enforce. I don't know.
So do we want to open that up to, where does that go from here? Does that go to staff patrolling the fairgrounds and seeing
You don't
whether
have
people are smoking in a
anybody walking
designated
around
area?
Turn somebody in, it says. Anybody can turn them in.
So
Somebody has to enforce it no matter what it is. And if it's this broad, I agree with Supervisor O'Connell. I mean, it should be in smoking designated areas. And I think as far as smoking in the rides, what you're going to find is the vast majority of people smoking there will be the guy or the lady running the ride. More so than somebody on the ride. So I think this is just way too broad. I think it's very easy to just say in a designated area, and there it is. If you're outside of that designated area, you can't do it.
So what's the consensus of the committee?
I think you and Kim are exactly right, Supervisor Olson.
And I think we can throw 3 in on it too, 2 and 3, because they're again sports arenas. I mean, what if you miss one little corner of it and I'm standing smoking in that corner? Well, then it's okay. But if it's a designated area, then that's still where you have to be.
So who is going to decide where the designated areas are?
Can I ask a question?
Yes, Tanya?
So the fairgrounds are county owned. Does that go over to the environmental chapter 12?
Oh, because it's county owned.
Does it go into parks?
We're going to parks too. So they would. So probably, in conjunction with the health department, to say, where is the best area? If you don't want to put it right in or anything, you would put it in corners or whatever.
Yeah, you pick 2 or 3 spots, and that's where the smoking spot. That's the designated smoking spots of
I think we could
not
provide,
just the fairgrounds, but all government buildings, really.
Yeah, anywhere. And then.
if you're expecting us to enforce it, that would be.
So,
And Rod would help with
So,
this.
Fran, can I
yes,
jump in real quick?
Yep. Interject.
I may be confused about what the issue is, maybe. My reading of the way the ordinance is written, that we're allowed to smoke in county parks and recreational areas under this particular section, unless it is specifically designated as a non-smoking area. That's except as otherwise provided. No person may smoke in any of the following spaces. Areas in county parks and recreational areas as posted and so designated. So unless it's specifically posted and designated as a non-smoking area, you're talking about the reverse, it sounds like. You're assuming that everything is a non-smoking area and you have to designate a specific smoking area. The way this is written, it's the reverse. So it's less restrictive than it sounds like you're concerned about. Just so we're all on the same page.
And does this integrate with public buildings and the environmental services piece of it in the other ordinance?
Can you rephrase that? Can you,
So,
what you're asking?
okay, let me think of a good way to say this.
It goes to chapter 12.
Yeah, how does this go to chapter 12 and integrate?
Well, in chapter 12, you can't smoke in buildings or county vehicles.
On county campuses?
Does not say county, it says in buildings or in the vehicles. So it's different, right? It's not, this wouldn't even apply
No,
at the fairgrounds, except for in the fair buildings, because the fair buildings are owned by the county.
Okay.
They would be, you can't smoke in them. So this still would, working with number 2 there, allow basically everywhere, unless we specifically designate that you can't smoke here, you're allowed to smoke anywhere.
yeah, that's,
So it's,
and that's what we want to do is contain it to a certain place that you can't just walk around and smoke everywhere. Is that what, that's the intent, isn't it?
well, not, we have not changed our ordinance to do that. That
Okay.
is not being contemplated at this time.
That address the questions that we have? Okay, I believe it does. So then again, continuing on 1687 on the next page, there are changes. 1688 signs, just.
Oh, back up just a second, can we, Chair? Number 1687 on number 7, again, what is that reasonable distance? Not meaning to pick on Supervisor O'Connell, but we used to smoke right outside the door of the government center there. So again, we're back to that reasonable again. So I guess what is that reasonable distance? Is it 2 feet outside the door? Is it 30 feet outside the door? Just a thought, not looking to necessarily change anything.
We believe it's 15 feet.
Okay.
And do you want to add that into there? To say 15 feet?
You could certainly change it from reasonable to within 15 feet.
Yeah, I don't have I think that's fine to do 15 feet.
Sure.
Looks like we have a consensus. I apologize. On the screen, I can't see any of you anymore. So because the ordinance is up on the screen. So, okay, I've got you over there.
Yep.
Okay, great.
The only reason the committee might not want to specify a specific distance is if the committee has a concern that 15 feet wouldn't be enough in certain circumstances. So if, for example, there were a ventilation fan that sucked air into a particular building and it was right next to an exit and you're smoking right in front of it, that would suck the air directly into the building. I don't know that that's the case anywhere, but those are the types of things where you would say, well, it's not reasonable to even be 15 feet. It would be further. That's where the reasonable language comes in. I don't have a preference, just giving you something to think about.
Yeah, it's just the word reasonable.
Of course.
Reasonable is or 15 feet is?
15 feet is easier for me to enforce.
Well,
Yep.
I'm looking here at the committee members. I'm looking at you folks online. Is everybody amenable to that on the committee? Looks like we have a consensus and I'm not missing anything. So we will include the language of 15 feet on that.
Just to clarify, for Helen to enforce, for me to prosecute. Sorry.
Yeah, we don't want to forget that. Okay. So again, I'm not trying to rush through it, but if we're ready to move on. 1688 is just.
I didn't think we were that far yet. So let's back up to 10 and maybe I'm misunderstanding this again, but so can I smoke in a condominium or a multi-unit residential facility?
Prohibited.
Because the multi-unit residential facility is my home. The condominium could be my home. The trailer park could be my home.
Area.
Common area.
The common area. So like our house doesn't have for an example,
There's a clubhouse or something like that.
Yeah, if you have a common area, open to the public at your house.
Okay, yep, okay.
Yep.
All right, then B.
Okay,
On number 2 and 3 on B. Does that smoke not leave the room of an assisted living facility? Just checking to see, because that seems a little a little odd that I can smoke in my room in an assisted living facility where everything else, just checking to see if the smoke stays in the room. Is that something the state says, or is that something is that a Polk County rule?
The licensing of the DQA, the
Yeah,
licensors at the
it's,
state level.
yeah, it's the state, Tanya is saying it's the state level licensing issue. I know, just for an example, like in Golden Age Manor, they have a room that residents can go in and smoke in.
No, not inside.
Not anymore? Oh,
Right, we're a county building. So
okay,
we have a designated outdoor
outdoor area.
area.
Okay. Oh, it's changed since my mom was there. A while ago. My mom did not smoke, but anyway,
Probably one that used to smoke in this building.
Yes.
yeah,
Happened.
yeah. So that's not,
So-
that's
So I
kind
can't smoke in the building, but I can smoke in my room.
That's a state licensing on your state
Yeah.
license.
I mean, that's up to the facility to determine, each facility can have those rules. I mean, I don't know of any facilities that allow smoking in them, but that's up to the facility, and then they have to have policies, procedures, all of that in place per
Do you
DQA.
want those stricken because they're taken care of somewhere else? Possibly. Does that make sense, Supervisor Olson?
yeah, that's
Sure.
that.
Duncanson?
Well, it makes sense. At least they're not there, because I think it looks, I don't know, kind of foolish that we're talking about a human health hazard, but then saying that I can smoke in my assisted living room, where I live at. It's just as much of a human health hazard to the rest of the people in that facility as it is anywhere else. Maybe more so because it's assisted living even.
So you think we can strike 2 and 3 as those are covered really with the state licensing and the internal policies of the facilities?
It's up to the committee. I mean, I think we could, but whatever the committee thinks, I'm fine with.
You have any recommendations, Joe?
I don't know whether there are specific state statutes that grant you the ability to smoke within your own private residence. I also don't know whether there are other potential protections for tobacco users. I have not researched the issue, so I cannot give you a good directive on whether or not it's problematic to remove that language.
No? What is your take on it?
I mean, I'm not an expert on assisted living rules because we're not an assisted living, we're a skilled nursing facility. So there's a lot of similarity, but I also couldn't speak to that specifically. Besides that, yeah, DQA is the one that's gonna, oversee that as far as if that's allowed or if they have the policies and procedures in place. But again, I'm not an expert in assisted living.
What I can say to the committee is I have not seen this be an issue. I haven't heard of complaints from assisted living residents that other people are smoking in their rooms. I haven't heard that there's a need that we issue citations to people who are smoking in their rooms. So ultimately, if there's no issue, I don't know that it needs to be addressed, but I'm not the decision maker. I'm just letting you know, I have not heard that it's a problem.
So, I agree with Brad. I'm fine either way, whatever the committee sees. So the rest of the committee, what are your thoughts on that?
I would leave it in there until there is an issue.
Yeah, I'm okay with that. Pam, what do you think?
Because I was going the other way to strike it in the sense that if it's an assisted living facility, they have their own rules and their own state statutes they have to follow. I don't know. I feel like it's a little bit outside our jurisdiction.
In all assisted livings I can say confidently are privately owned.
Right.
So there's none.
If it's outside our jurisdiction, I think makes sense to strike them.
Well, I just clarify. This is saying we can't enforce.
The only thing that we can enforce is our public buildings. We can't enforce anything on private.
And that's kind of what this says.
So if we were to strike it, we would basically be saying, hey, we can go after you if you're in an assisted living.
Well, then we'll leave it in.
Then, okay. Appreciate the clarification.
Yep.
Thank you.
Yep.
Yeah.
He's in the room.
Yeah,
Yes.
I am too. I am too, definitely. So, okay, I think that's been clarified for us and we're going to leave that in. The signage and the vaping, just adds vaping additionally and with smoking.
Just, I had one note there. Would you add a phone number on there, like the health department's phone number or somebody who's gonna enforce it? Instead of having 911 and they call the sheriff and he says, now you gotta call somebody else and you call somebody else.
They'll send them over to us.
But it would save that. Maybe some confusion if it's the health department that they call first. Does that make any sense than having to call 911 and then they have to refer it to somebody else?
Yeah, what, after hours would be a concern.
Okay,
So we
Yeah.
default to the dispatch for any after hours and then they contact us.
okay. I never thought of after hours. All right, that makes, all right.
Yeah. Did you have anything, Sam?
I'm just saying, I hope people don't call 911 for someone smoking. That's all. I hope
Non-emergency.
that-
We have a non-emergency.
Call 911 for many
Wow,
ways.
911?
Yes. That's why I said it'd be nice.
Well,
to
those
have-
poor people on 911 are overloaded the way it is.
That's why I said, get that. moved
It
out
is
there.
a non-emergent line, but they also have 8300. So
Yeah.
hopefully they're calling that line instead of 911.
Yeah.
Would that be a number to put on the sign then?
So who takes care of the violation if it's after hours? I mean, there again, we're gonna call law enforcement for somebody smoking.
Yeah.
I guess I have a problem with that. That doesn't really seem like, I
Yeah,
realize, Chair, I'm gonna jump ahead a little here, but on 1690, the county sheriff is put down as enforcement, and I'm not really sure this is something that we either need or want our law enforcement working on. I think they have bigger problems than if I'm
They can't be
standing in the
involved
wrong
in that.
spot smoking. I think that really does, that's for me an issue if we're actually saying, call the county sheriff if somebody is smoking, in the wrong spot.
So Brent, do you want to weigh in on this?
Yeah, I would say we don't want to be involved in those kind of calls. However, I recognize we are the only 24-hour call center. So, like with prior things when public health needed to be notified, we just simply send the message over to their phones. But I wouldn't want signage that says, call the sheriff if someone's smoking. I wouldn't want that.
No.
I think most people know who to call if they want to report a violation. Most of the time, people on these smoking complaints just send me an email. I get a lot of emails that, I was traveling through your county and I stopped somewhere and people were smoking in this building. So I think most people recognize it's not an emergency law enforcement issue.
Okay.
I think I know our current signage doesn't have a phone number on it. It's just the standard, no smoking, don't smoke there. And the concerns that we field, it's more like a habitual thing where people notice, there might be a concern with this establishment or something. And then we go out more as that education piece, like, hey, this is the rule, this is the thing. So oftentimes it doesn't lead to that citation. It's just more that education. Are you aware this is a reoccurring thing and this is what the rules say?
And just removing an enforcement officer doesn't mean that the calls aren't gonna come. It just means that the sheriff's office, if they get a call, is gonna have to say, there's nothing I can do. It doesn't stop the call, because those
They can
people
call
are still
whether
gonna
we
call.
have that or not.
It just
Yeah.
removes a tool from the sheriff and deputy's tool belt. Should they ever want to issue a citation for some reason, they would no longer have the opportunity to do so. I'm not saying that's good, bad, or otherwise. I'm just saying that is what you would be doing, is removing a tool from the tool belt.
If you go to
Yes,
the
Bill.
top of the page, that same page that we're on, up above 1690, and go to number 3. They're talking about there's a smoking violation. It says in there that the person in charge shall immediately notify the local law enforcement agency of the violation. So what does that mean? Does that mean that you're gonna call the sheriff's department right away? You're gonna call the local village? How, I'm just looking at the wording there.
Yeah, and for, cities and villages that have their own local police departments, that is their local law enforcement first step. Out in the towns where they don't have those, then that would be the sheriff's department, is my understanding of how that works.
And that really is a trespassing ordinance more than anything else. Essentially, it's saying, if you ask a person to leave because they're smoking, I mean, you as a proprietor can ask a person to leave for almost any reason you want.
Yeah.
But this is saying, if they're smoking and you say, hey, you can't smoke here, and they refuse to leave, you should contact law enforcement. That's what that ordinance says. It's probably, I mean, that's true regardless, but it makes it more clear that basically you're trespassing them, basically, and you should contact law enforcement if you're trespassing someone and they refuse to leave.
Should that be noted? Should that trespass ordinance be noted in that section there
So I don't know that I mean,
by statute
probably
or
have a
by
trespass
ordinance?
ordinance. I don't know that it needs to be, but
It crossed my mind that it was trespass, but I wasn't exactly sure how that.
Yeah. I'm refusing to leave.
Okay, I'm fine the way it is, but just a note.
Okay, I think that's been clarified for us. That would be trespass.
1694, that reasonable distance is there again. Do we put 15 foot there?
I think we discussed putting, that we can put in 15 feet, but that there are situations on a case-by-case basis where 15 feet may not be adequate. If there's a fan or something there that's
So
going
you're gonna leave.
suck
these
the
just
smoke in,
reasonable?
I think we should leave it.
Okay.
Because this is a private establishment as well.
Yeah,
it gives the authority to the private
Private
establishment.
establishment to decide.
So long as it's trees.
Are we on enforcement?
I believe we're on enforcement, 1690. So enforcement, again, it looks to be mostly a language cleanup and tobacco product and adding vaping in. Is there any questions on that? If not, 1691 is,
Going back to 1690, I think we should, it looks like we struck cigarette or tobacco product, but
yes,
because we have that definition of cigarette,
Consistent,
essentially we would
yeah.
be removing the ability to enforce cigarettes. So I think we should add it's a silly way to
It's
phrase it generally, but if we're going to define them separately and say that tobacco products are everything but cigarettes and cigarettes are this specific thing, we need to say both. So it's unfortunately complicated language, but it needs to be there if we want to enforce the way we want to enforce based upon how we have the definitions drafted.
So the use of a cigarette or tobacco product?
Correct.
yeah, to leave
just-
that in.
Not to go back, but on that same topic, I think a similar thing happens at the beginning of Article 3 for under purpose, which doesn't really make that much of a difference, but we struck the word cigarette in 1685 as well. And I think it should be added back in there as well. Again, simply because of,
To keep it.
it does complicate the language. It's more clear the way it was changed, but we need to have that because of how we have the definitions drawn. So good call,
Yeah, it's just a bizarre
Supervisor.
cigarette thing.
Yes,
One other question on 1698. It says that said designated enforcement officer shall have the power whenever they may deem necessary to enter upon the premise named in the section. What's the legal ramification of Helen walking into a place? Could she just walk in as a designated officer? What gives her that right?
So you as an enforcement agent for civil issues on a Property that is open to the public, she would have the opportunity to go in. This enforcement ordinance would give her the authority to go and ask for permission to go onto private property that where this can be enforced. In circumstances where the owner of that property says, no, you cannot enter, she can't just put, it's not like, you can't say, well, I have probable cause to believe a crime's happening in here, therefore I'm going to enter. And because there's some sort of emergency situation that requires me to do so, she would have to say, come to me, say, I'm trying to enforce our ordinances. I have a lawful authority to be on that property to enforce this authority. Can you ask the court for a civil warrant? They said they wouldn't allow me, and she needs to get a no. She needs someone to tell her, no, you cannot access the property to enforce this. Then she comes to me, I get a civil warrant, then she goes back, says, I have a civil warrant. We usually go with the sheriff's deputy, say, let us onto the property, and then they're obligated to do so. So this doesn't mean you can just go and do whatever you want. It means because this is there, she can get a civil warrant.
Okay. I was looking
Boy,
at-
that's complicated.
I'm looking at the difference between probable cause and reasonable suspicion.
And in similar to other public health issues, they have the opportunity to go and have the authority to go and do an inspection of things that they have the authority to inspect. They don't necessarily, now we don't have the capacity to just go around and do spot checks of anybody and everybody. But theoretically, they could go and say, hey, I have at least an inkling that there's something wrong with X, Y, or Z. Let me on the property to review it. You say no, okay, I'm gonna go get a warrant.
Do you want an example? I can. think of
Similar
an
to an
example.
appraisal, like if
An
an appraiser
assessor?
comes to your house and says, my job is to appraise your property. I have the authority to appraise your property. Let me onto your property. And you say no, okay, that's fine. They will leave and they will get a warrant and they will come back and they will get into your house.
Sure.
Also, as an aside to that, is that if you refuse to let the assessor on your property and they have to guess what your assessment is, they're gonna guess high. So you actually are probably better off to let them on instead of let them guess, but for what it's worth.
So an example I can think of is, from time to time, we get calls from somebody who is actively using oxygen while smoking in an apartment building.
Yikes.
That would be an issue for us where we would have a concern and probably want to get in there to make that assessment. So
So that isn't like zoning too, though, if they have to pull a permit or anything, or have a state permit.
If you have a permit, you are
It's
granted,
usually in
You're
there
granting,
that
yeah.
they can come in.
right,
Yes.
you're
So if it's a
essentially
permitted issue,
waiving.
They can go in and do the inspection.
Okay.
Because that's why the permits,
Have to be posted.
all the sale, off sale, on sale, like in bars, they always have those permits up and stuff.
So that still
they
doesn't
can
mean
go in
that
there.
you can just force your way into a property. You still go and say, let me on, you told me I could.
Reasonable business hours and things like that.
But if they say no, then their permit gets pulled.
Yeah,
Doesn't mean they have to let you on the property. It means if they say no, their permit gets pulled. So it's,
so that's a lot of it too, that you can use that part.
no one's forcing their way in anywhere in Polk.
Don't we have a SWAT team?
Illegal.
No?
We are not illegally entering.
Ninja is going for it. See Helen pulling out the ninja and just going,
Yeah.
you know it.
You have conceal and carry.
And as long as you have an unmarked car.
There we go. Okay, we were on 1690. We backed up to 1689. So are we back on 1690 now? We did appear to have a consensus to leave in the cigarette or tobacco products in the interest of being uniform with the rest of the ordinance. And the addition of the word vaping again. So I'm gonna take a pause for everybody to, make sure they're ready to move on. Okay, I don't want to rush anything. 1691 is the violation of forfeiture section. So there's, the warning section remains the same. The forfeitures The dollar amounts are the same. Just the change again of any person in charge. Well, that could be a bartender or, an employee. So this would have the proprietor or employer be subject to the fine. Again, section 3 does the same thing, the other person in charge. Section C is just,
We stay there for a second.
Sure.
In our general deals that we have, we put all this in a schedule. So if you change the fees, you have to open up the whole chapter.
we're not changing the fees though.
No, but I mean, you would have to, if you change it next year, you gotta open up everything.
Yeah.
But you should have a fee schedule for this in your department for these. I think everything else has
I
a fee
think,
schedule.
is it part of the county fee schedule? It's not?
Citation is not. Sure it is.
We don't have it included in ours, is what we're saying.
It's not included in yours. Okay.
We can add it in when we do budget next year.
Shouldn't it be in a fee schedule like everything else if it changes?
You could say, you could,
Okay.
the way the statute specifically written, it sets out specific dollar amounts that would require an ordinance amendment to change those amounts. Fee schedules get modified every year. Theoretically, you could change this language to say pursuant to the fee schedule as adopted each year by the Polk County Board, and then they would be able to change them every single year. So it would be an easier mechanism to change in the future if we did that. Nothing requires that, but
Doesn't require it.
Yeah.
I mean, I'm just saying, but I think if we look at some of our general ordinances that we're trying to put everything into a fee schedule.
So you want to pursue it to schedule?
That's up to you.
Well, we
guys.
have to add it in the fee schedule maybe before we change the language. You
Or
think?
that's something we would do next year.
Yeah,
Amendment,
Yeah.
add it in.
maybe moving forward next year.
Budget, because the fees are already set.
Schedule?
Yeah.
Schedule.
Yeah.
I just,
It would be something moving forward to do,
Yeah.
because you're not gonna change them this year. Is what you're saying.
it'd be something for next year if we're gonna change all the ordinances to reflect the same language to go to the fee schedule.
I think it says in our
It just makes it,
ordinances that we're supposed to be doing that.
just want to be careful that it doesn't make the opportunity that those fees continually change without someone catching it or
Yes.
without noticing. That these are kind of set.
And they're usually set for inflation and everything else, like every other ticket.
What we
And
can do though is add these fees in the fee schedule and block them out with a color to say these are in ordinance already, so that staff or someone just doesn't want to change them.
sure.
That simply might be an easier mechanism, and that way we can look at the other ordinances to make sure they're all in one spot.
What does the committee think? Committee have any views on that? I would think that moving forward, if that's something we can address in the future, that's a reasonable way to address it at that time.
Because these are more penalties versus a county. fee.
Versus a fee, yeah, like it's not like a user fee.
Correct.
Yeah,
It's more of a penalty.
it's more of a penalty. Yeah, I agree with that.
it's a fee to smoke in the building.
Oh, jeez.
Per cigarette.
It's not a
Per
fee, it's just
cigarette.
cost.
Oh, my. Okay. Citations, ooh, now, so 1691, we've looked at the changes that were proposed. The rest of 1691, are there any questions on any of those items?
Like, how many citations have been given out since this has been done? What was it in 22? Do we know?
None that we're aware of.
Zero.
Zero.
Zero citations. Moved a lot of work over nothing, isn't it?
I think Helen pointed out, a lot of the work is educating the public
Yes, I know.
on what they should and shouldn't be doing. and that they could receive a citation, and that usually alleviates the problem. It's similar to zoning. We want people to be we don't want to be issuing citations. We want compliance. So educating and then correcting so that we don't have to issue the citation.
You know, I guess, you know, too, I think that there's always a responsibility. You don't want to be heavy-handed, and that education is always better than enforcement. But at some point, people need to know what the penalty and what the results of their action or inaction is going to be, what the consequences are, you know, by telling them that that's a possibility. So.
I think everybody's conscious of penalties.
Yeah. Okay. Our penalty section, does anybody see anything there that they want to take another look at? Since the committee reviewed it. Then I'm going to look at section 1692, additional private prohibitions. That just states that, you know, if it's a private place, they can make their own rules and we're not going to get involved in that. Is the gist of it. And I think everybody thinks that. Okay. So it looks like we pretty much have that we went through chapter 16 pretty thoroughly. Chapter 22, articles 1 and 2, basically is striking those because they were found to be covered elsewhere. So that is more or less a language cleanup. We didn't see anything in here that wasn't already covered. So the committee consensus was to strike it. So has anybody changed their mind? Or see anything they want to keep out of there? Personally, I don't. I'm like, you know, it's covered, get rid of it. Okay, so that, if there's no other further questions or comments, and I'll take a pause for the cause here. If, you know, anybody has anything that they want to bring up.
Thanks to the people that did all the hard work.
Yeah, there's a lot of heavy lifting on this,
Well
more than
done.
people realize.
Well done. Thanks.
And, yeah, Pam volunteered for that, so way to go, Pam.
I didn't do nearly as much as they did.
Yeah, yeah, we appreciate that. Okay, are we ready to move on then to the alcohol compliance presentation? Oh, I'm sorry.
If I would ask that if this committee thinks that it is ready for a resolution to be brought in front of them, that this committee move to direct me, I think is the language in our rules of order, direct me to work with staff to draft a resolution to bring this forward to the committee at the next meeting.
Okay, so the resolution goes to the committee, which would then make a recommendation to the county board.
Correct.
Okay, so
There should be probably minimal discussion at the next meeting.
you never know. And that's okay. So do we have a motion? I
I'll
could-
motion to move it forward.
Okay, so Rita makes a motion to move it forward.
Sorry, move to direct the corporation council to draft the resolution.
Based on the changes.
Yeah,
Move to direct council, to draft resolution.
okay, with the, do we want to throw something in there with the consensus changes?
With the changes, yes.
Yes.
Okay, is that okay with you, Rita, if we throw that in there?
Yes.
Okay, very good.
Yeah.
So does everybody understand the issue? Okay. So is there a second?
Second.
Okay, and the motion is second. Dr. Lyman, motion has been made and seconded. Is there any discussion on the motion? There's no discussion, then I will ask for a vote. All in favor, please respond aye.
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 If there's anyone opposed, please respond nay. And there's crickets. I don't believe there's anybody opposed. So with that, the motion carries.
Thank you.
So
Next up.
Supervisor Olson, gotta step away from the call.
Oh, okay, yeah. Yeah, so we'll have that in. Okay, so we have, the next thing is they're passing out is the alcohol compliance check. Presentation. Thank you.
I didn't. Oh, sure. I would, yes.
Take a seat.
Thank you.
All right, well, I will get started. This is a presentation of our completed 2025 alcohol compliance checks. So a little background on the process of compliance checks. In 2025, we completed 40 alcohol age compliance checks at off sale retailers and on sale, we're going to call taverns across the county. We used 18 and 19-year-old volunteers and they went in with their legitimate vertical Wisconsin ID. So when you're under 21, it has the ID that goes vertical. It says U21 on the top, and then on the bottom left corner, it says the different 18 and the date teacher 21. Our intent is not to deceive or trick retailers. We give strict guidance to our volunteers. Do not appear to look older. Like, don't do your hair or makeup or dress differently than you normally would. Just do your appearance. And public health's goal in doing these checks is just to get us a better understanding of access to alcohol to our youth in the county. So it's data collection, just an understanding, and then that information helps guide our education and outreach. Not only outreach to youth, how are we doing alcohol prevention, education information to them, but then also our retailers. Next slide. So our process is every establishment annually receives a notice of compliance check. So that outlines that this is something that public health will be attempting to do in the next year. We also give information about Wisconsin laws and then step-by-step, like hints, tips on how to check IDs and how to do. Then we check with all law enforcement agencies. They're contacted and we ask if that agency will be willing to support our compliance checks, either by allowing the checks to happen in their jurisdiction, by, if they have the capacity, sending an officer to accompany us on the checks, or to provide a written citation if a sale is made. Once we take that information, we compile our check dates. So checks are completed across multiple days and times. And this year we did use different male and female volunteers. And these underage folks are always accompanied by a public health study. Okay, so then we go out, we do the checks. If a sale occurs, we notify law enforcement in that jurisdiction either immediately or the next day based on the request. And it's up to that law enforcement agency to determine if they're going to issue citations based on that information or not. All of our 2025 checks are completed. We send the retailers a letter that we're checked. So either a congratulations, you were checked and there was no sales, or you were checked and there was a sale at your establishment. We also send letters to municipality leaders with specific information about how their jurisdiction did with sales or compliance checks. And right now we're at the final step. Once those steps have been completed, then we share our annual, compiled information to the HHS board, the general public.
Helen, quick question. When you said that you send out annual compliance checks, how many Polk County?
I believe it was
No, off the top of your head?
176. And that is to the VFWs and
Right.
Everybody that holds a license.
So there's 176 places that either sell alcohol off sale or on sale.
Correct.
Okay.
Yep. Next slide. And just for some background information as I'm going through the data in the next slides. From my knowledge, 2019 was the first time we completed these checks. So we did it in conjunction with the Sheriff's Department. And at that time, we just did checks within the Sheriff's Department's jurisdiction and retailers. Then COVID happened, it was on hiatus. 2023, we came back. Again, completed checks with the sheriff's department within their jurisdiction, retailers. Then we got feedback that owners were interested in having taverns also checked. So we reached out to municipality police too. So in 2024, we did retailers and taverns in the municipal PD jurisdictions. And then in 2025, we did this process. So on the next slide, when I'm showing comparing dates, I'm only looking at 2020, 2025, because apples to apples. Otherwise, it's like apples to kind of numbers.
I have a question, Helen. So in 2024 and 2025, did you, municipalities that had local law enforcement?
Yep, so we follow that same process we talked about earlier. We reached out to all law enforcement agencies, and then the ones that responded back that, yes, we will work with you to do those checks. I believe this year.
All municipalities responded back.
Correct.
Okay.
Yep.
So are the taverns or stores or whatever that are not in a municipality, did they receive compliance checks?
They were checked, but they did receive our annual letter. It's a reminder of Wisconsin laws and how to check IDs.
Okay, and so why are we not checking them?
It's based on the local law enforcement, so if sheriff, the police chiefs, they're the ones who allow us to go in. We can't just go in and check. It's illegal for a minor to go in and buy alcohol, so they have to give us permission to go on to those establishments. The volunteers are all adults, but still they're not 21, so we need that permission.
So for more context, there's 12 total like law enforcement jurisdictions within Polk County, and then 8 of them we received permission to check in 2020.
Okay, I guess I'm just a little bit confused why we're given a pass to, I don't think, yeah, I'm not saying anybody's being picked on, certainly, but I guess I'm just, and I don't want to see it on certainly. But I guess it seemed to me only the ones in the town get checked as well. I don't know what we need to do or not do so they do get checked. That's a question I can't answer. I don't know if anybody here can or not, but maybe something for us to think about. They might feel, too, they're maybe a little more isolated, or it's, they don't have a police car driving by or something, just my opinion for what it's worth is that we should check everybody, or we should check the towns as well.
Further ado, so 2024, 2025, 2024 checks are in that light blue color, 5 is the darker color. 2024, we did 47 checks. 2025, we did 40 total checks based on our volunteer availability. So that's why I turned the numbers into percentages. So you can see we had about consistently like a 30%-ish sale rate between 2024 and 2025. All right, and then on the next slide, I broke it down based on establishment type. So retailers, taverns. So this time, the light color is the percentage of sales. The dark color is the percentage of no sales. So again, it's pretty consistent between the last 2 years. Our taverns are selling rate of sales is about 30%, whereas our retailer rate of sales is about 20%. And on the next slide, I did have an error. I flipped 64% and the 45% slide. They're flip-flopped. That was just my error. So you can see this slide discusses of those sales that did occur, how many of the retailers check the ID. And as you can see, by the dark purple color, that's the percentages of times the clerk would take the ID, look at it, and then still sell. So about
shame on them.
50%. I did note, so both Tanya and I did checks this year, and we heard from our volunteers pretty consistently that there was confusion in how to find the ages. There was it's dark in here, I needed my glasses. Or sometimes there was like, you're 21, right? We can't lie, we can't just, at that point we had to say, no, 21, and then we would leave. But there was definitely, we noted confusion on how to do that math to each.
Gosh. It would seem anybody with an operator's license or working under the direction of an agent or an operator's license, you know, that's like a pretty basic thing.
So more to come on that.
Okay.
Right. All right, so on the next slide is our next steps. I'm thinking about this in two kind of branches. One is how do we get that information to our retailers to like, what is the barrier to checking IDs? What is the barrier to finding how old somebody is? What's the barrier to refusing a sale? So Tanya and I met with the president a couple weeks ago, we showed her the same posts. And we talked about how can we collaborate in the future in everybody's best interest that underage folks aren't alcohol. So how can we help support the education to the clerks and retailers? And we came up with a couple ideas, just informally talking with the president. I think there are some gaps in the training and education that retailers receive. They need to take that bartender's class, but how frequently does it happen? So I'm thinking like, how can we public health support with a really quick video or a really quick information, just that like annual refresher to the people actually pouring the drinks. We talked a little bit about the ID scanners. We noticed many of the retailers use that. So it beeps if you are under 21. And then also increasing the like no sales under 21 signage. And I think it was a very positive collaboration. They're going to be bringing our information to the Tavern League, and then as a whole, we'll continue to move forward. That's next step. And then the other piece of it is increasing our community messaging of the importance of talking to kids about underage alcohol use. So there is an initiative that I'm going to be kicking off with other community partners. April is Wisconsin Alcohol Awareness Month, so this information I think would pair perfectly with that, just about the importance of talking to kids, even starting as young as age 8, about alcohol. And I think also hitting the hard questions. So when asks, hey, mom or dad, but did you drink when you were my age? Or, hey, I see you having a drink now. What about that? And not that any things are those bad, but how do we help parents answer those questions and navigate our culture of drinking? So, questions?
Yeah, the culture, you know, I mean, this is Northwest Wisconsin. You know. I got my mom and dad in the garage 18th birthday because the drinking age was 18. And, so I get that aspect of it, but you know, I think it's important that we recognize alcohol in my opinion, as much of a gateway drug as anything else is. So anyway. Okay, thank you very much for putting that together for us. Does anybody have any questions or comments? No? No questions or comments? All righty. Then without any questions or comments, our administrator's update.
Yes, Madam Chair, just a few things. December sales tax was up 12% from the year before, so that great news. General government has changed their micro purchasing threshold from 10,000 to 15,000, so to update, to match that. That'll go to general government tomorrow and then hopefully to the board. We are in the third year of the MOU, just for your awareness, with the Fair Society, so that'll have to be updated this year. The new baler at the recycling center is being installed this week as part of one of the big equipment purchases there. We finished 2025 with 8 fatalities on our highways, which is down from our average of 11. The 2026 county forest payments to the towns has gone out. It was shared between 7 towns, $47,080.63 based on their acreage in the county forest. And the land and water tree sale is currently online and open to purchase trees. Some of them are already sold out, so please be aware of that and go online to buy trees if you need them. And that's all I have right now.
Okay, thank you, Mo.
Dr. Mo, what was our total sales tax? Have you got any figures on that?
It came in at 5.3. Final sales tax was $5,303,937.
Up from a year, up from last year, 24.
Up from last year by about 241,000.
That's progress. Thank you, thank you.
Anybody else have any questions or comments for Mo? Okay, does not appear that way. Communicable disease report, Helen.
All right, we are in the thick of respiratory illness season. In the western region, Wisconsin, influenza cases are very high and even increasing. From October through today, Polk County has had 12 influenza-related hospitalizations. COVID-19 levels in the western region is currently moderate and increasing. We've had 17 hospitalizations from October to today. And then RSV in the western region is low, but also increasing. And we've had 4 hospitalizations. December had the first 2 pediatric deaths in Wisconsin for respiratory illnesses. And then also our neurovirus as Wisconsin, so that's that nasty GI bug, vomiting, diarrhea, that's also starting to uptick. So reminder, wash your hands, stay home when you're sick, all of that stuff.
Okay, thank you very much. Okay, our comprehensive community services update. We have some documents here for that. So we'll go to Tanya to take us through that.
All right. So I'm going to turn it over to Lisa right away. She's going to talk some nuts and bolts of what the CCS, Comprehensive Community Services Program is. And then I'll do the last couple of slides where we're talking dollars and cents on what we're proposing and switching to in 2027. So take it away, Lisa.
Thank you, thank you. So just kind of to lay some groundwork about what is CCS. So CCS, one of our fabulous C acronyms, so it's Comprehensive Community Services. Comprehensive Community Services is a recovery-focused, client-centered program that we have in the county. The goal is really to help people to develop a treatment plan, or we call them individualized service plans, to address their mental health and or substance use needs, to promote their recovery journey, to also help them live their best life, to find greater life satisfaction. We offer both traditional and non-traditional services in CCS. Some of those might include employment training. So we work with organizations to do that, financial management, helping individuals learn social and coping skills. Also, we provide peer support services. The traditional services would be like your traditional therapy, medication management, or psychopharmacology. And then our goal really is through formal supports in those areas is to help the individual build natural supports so that they can move on to the program and have those supports to continue to move down their path. It is a Medicaid funded. Yeah. Oh, more to add? Oh, okay. I just heard you take a breath. And then it is a Medicaid funded program. Counties are required to be a consortium in order to receive 100% reimbursement for the CCS program. And there are really 2 models, if you will. One is called a multi-county model, and one is called a shared services model. So a little bit of data on the next slide for you. Through Q3 of 2025, we got Q4 data. Polk County served 169 individuals in our CCS program. We have 10 facilitators, service facilitators, and they are cross-trained in both CCS and then also in our children's long-term support, so they can provide that service across. We are also contracted providers within the CCS program, so we kind of wear 2 hats. We have a CCS program, but we are also vendors. So through the clinic, we provide vended services to individuals who are enrolled in the program. We have 6 service providers, and then we also provide services for other counties within our current system.
Did you have questions, Pam?
I did, just in going through this. So Does this mean that since it's a Medicare reimbursement program, that the person that's receiving services has to be on Medicaid?
Correct.
Got it. Thank you.
So our current model is we are part of a multi-county consortium called the Western Regional Wellness and Recovery Consortium. Chippewa County is the lead for that, and we have 9 counties in that at this point in time. What we are planning to move to, we have joined this WRRWC, if you will, back in 2015, and we are moving to a shared services model in 2027. And that would be with Pierce County. So we'll be leaving the WRRWC to create our own shared services model.
Do you want to just maybe provide just a couple comments on why we were looking at that change, at making that change?
On the very next slide.
Okay, so we've been a part of that consortium for the last 10 years. Actually, it's when CCS became a program in Wisconsin, was right around 2014, 2015, something like that. So we joined on right away. The incentive was great because we received 100% reimbursement. We don't have any other programs that pay us 100% through the Medicaid program. So it really was in our best interest to meet the need in the community and also get fully reimbursed for the services that we were providing. So within those last 10 years, we have grown a lot. The consortium has grown. I think when it first started out, there was maybe 6 counties total. They've added on some counties. They've gotten very large. Chippewa is the lead. And through our governance contract, Chippewa is basically the decision maker, even though county directors are at the table. We have found some discrepancy in how much we are actually able to input to make those decisions because we do have a lead county providing those administrative decisions for us. So why the move to the shared services is because we believe that we need more local control of our quality assurance, quality improvement. A couple of years ago, we had a big significant case that got turned over to the Office of Inspector General for some Medicaid fraud that the county was put in a position of not knowing about it. There was no way for us to know about it. And the risk would end up back to the county. So if OIG found that there was the fraudulent activity, Polk County would have had to pay a substantial amount of money back to the Medicaid problem, back to the state because of the problem, without us having any control of how that happened. We were just going to have the risk because it was erroneously billed on behalf of Polk County Services at the lead agency rate, if that makes sense.
That makes perfect sense.
Okay. The other thing is that we have more local control of provider rate setting. So we're not in total alignment with how the lead county is setting. We believe that we can set them in a more cost-effective way for the Medicaid program, for the taxpayers, for the local. Some efficiencies created by eliminating duplication. It's starts in our county and then we have to pass it on to another county for processing. So there's a lot of steps involved in actually getting a dollar in the door here. Better control of our provider network. So we, local first is always, I think that's even a policy, a county policy that we need to shop locally if we can. So creating that, defining it more solidly, the local services for the community. Know that there are some onesie type of services that are specialties that we may not have in this. They're still obligated to provide those, but we believe that they would be rare on occasion, but it's going to happen. What happens now in the consortium? So because there's 9 counties with contractors. When the service array is presented and the contractors are presented, we can pull from any one of those services. So if a service is in Russ County, most likely we're going to pay a Russ County provider to come here to Polk County to provide the service. So it's a lot of travel time that we spend. So that's, we want to look at condensing that circle a little bit so we can reduce some of those costs. And then lastly, better security and chain of custody for our consumer records. It's wobbly right now because the is maintained by the lead agency. When our licensor comes here, we have to figure out how to get them into that record. Now it will be contained locally. We have total control of those records. So it's a chain of custody thing for us.
I think you need a congratulations on that move.
I would agree.
Thank you.
Mhm.
Yeah, yeah. Well done, looking out for the county's best interests and.
Okay, and then I have some
Agreed.
here for you.
Oh, we got the financial information.
So, so like Lisa said, we have a provider side through our clinic, and then we also have a case management side, so the service facilitators. So the 10 service facilitators, we build a rate that reimburses us. We throw everything but the kitchen sink in there, all of our admin costs, our building rates, and everything that we process to operate, to provide a unit of service. We have a rate set for that. So on that side, so the service facilitator side, that's not included in this information. This is our contracts to provide services to consumers. So what we are proposing to be able to do this locally is to hire 3 staff who are already in our staffing plan. We've already got them budgeted. We're not adding any additional support staff at this time. We are going to try to make some shifts in the business services office to be able to take it on without adding administrative staff. So with absorbing this in our current FTE count, we would anticipate about an $8,000 in revenue that would have been levied, get reimbursed 100% because the kitchen's so it's an additional amount of revenue that's coming in. And I know Kathy is very conservative on that 80,000. We don't want to, overpromise. So 80,000 is her best guesstimate. And then we also, the other issue with the Lee County is that there's a working capital requirement that we have to pay Chippewa because of their revenue cycle analysis. Providers get reimbursed in real time. So I provide the service, I submit my billing, I get paid 100% upfront. Wisconsin Medicaid bills, it's called like a temporary rate. So it's about interim rate. So it's about 60%. And we pick it up on cost reconciliation the next year. So it's really confusing. But you're getting paid up front. We have to make sure so every year they look at how much we're providing services and they give us an estimate for it's 45 days to before they get their Medicaid reimbursement, if that makes sense. So Chippewa's sitting on $328,000 of ours. We're going to pull that back here. We'll still have it because of our revenue cycle analysis will be very similar. And we still have to pay the providers up front. However, it's just local control of that working capital. So projected revenues from Wisconsin Medicaid, this is just for our contracted services, is about $4 million a year. So that's a lot of money running through here to provide those needed services to those consumers. And then for that reconciliation piece, we would look at getting $408,000 back approximately, depending on how many services we provide. And that's always the following year. So we're always, that's just the way it is. I don't think it's ever going to change. The state will now give us a loan of our own money to be able to cover our costs in the current year. So we're considering doing that, using our own money.
Does it have an interest rate associated?
Well, that is a different discussion.
Yeah.
So it's all together.
Yeah, exactly. Probably outside this space.
Yeah. So expenses, we anticipate, staff expenses are 386,000. Operational expenses, that's copy machines, paper, all of the stuff we need to be able to operate is about 21,000 a year. And then those contracted services 4 million. So it's a money in those contracted services. We get reimbursed through our WIMCR, if that makes sense. So I think if you add 386 plus 21, it's 4. Yep. The math on this sheet.
Math, just the math.
The positions that we're adding, part of the contractual or the statutory requirement is quality assurance and quality improvement. So there's, what do they figure, about 1,800 records coming in here a month? A quarter?
Invoices, yep.
That have to be quality assurance checked to make sure that we're billing properly and that the services were happening.
Yep, and the content of the document matches what we're saying the needs of the consumer are.
So if there's an audit, we're not going to be out of compliance because we have that upfront checking of the records. And then the other is a contract manager who will do some CCS contract management as well as our other contracts that we have already. So we're carving that out and having a contract manager who will also do provider training and what did they do? Just getting them set up and onboarding.
Yep, onboarding training, ongoing training, initial training.
And then also, lastly, I think a clinical coordinator, because the other part of the requirement by statute is clinical supervision. This is a Medicaid program. It's also for mental health and substance use. So there's that clinical component that needs that clinical level of person to supervise services happening, to ensure that they are in line with the service plan, the assessed need. So just another checks and balances system for that, but it's also required by statute. So those are the ones that we have to add.
Is Polk County going to be the lead county between you and Pierce?
There is no lead county in a shared services. We just need to designate what services we'll be sharing. So we are anticipating sharing our policies and procedures. Training. So we'll just do that in conjunction with each other. So there's no lead agency rate or anything like that. We run our own program. They run their own program. Those are the shared pieces. We did talk about if one of us is a clinician, clinicians are really hard to find, that we would have a mutual aid with each other to provide some temporary relief while we are recruiting or the other county is recruiting.
Why Pierce County?
I would say we have very similar philosophies about services and service provision.
Similar size.
Yeah, very similar.
And similar struggles with the consortium that we're in right now.
Who are the other seven counties?
Oh boy,
pop quiz. Fern, Rusk, Chippewa,
Dunn,
Pepin,
Buffalo.
Barron?
Barron belongs to a different consortium. They belong to the BEST consortium, which is Barron, Eau Claire, and St. Croix.
Oh, bigger, yeah.
Barron used to be in our consortium and they pulled out.
Maybe 5 years ago.
Yeah, something like that.
And they are a shared services model as well.
Yep.
Just out of curiosity, what do the other 7 counties think of these 2 counties splitting out?
We will continue to work with those other counties. We would share our clinical services. We would to other counties in the consortium because it's real money for us. If we have availability on our provider end, so we're going to keep our providers up. We have contracts with the other anyway, so that's been a common practice. But yeah, it's been well received. We wanted to start small, just one other county and us. There's no limit on how many counties can be added. I think St. Croix also did similar. They started out with St. Croix and Eau Claire and then added Barron on later. So it would just be based on request.
So the move basically is because of a policy procedure issue with Chippewa, them making more decisions and you not getting the input, and then based on a monetary decision?
Local control.
Yep, local control.
Some heads up about this kind of as this process has. And I just feel like I want to be associated with any organization that has even a hint of any type of fraud issues. And so I think that this is a really good move.
OIG's our big dog.
And having somebody else create, financial liabilities for us and yeah.
And I know, Mo had wanted us to address the Medicaid funding and the one big beautiful bill. We don't have any indication of any implications at this time, that funding is getting reduced or changed up on us at all. Not that we're aware of.
Does that impact, Diana, anything that you have coming out of your economic support office as far as?
So as far as the CCS program, so we are working jointly together. I was just provided a list of providers today or consumers to check on what level, or I should say their Medicaid status is, to have a better idea of with rules coming in 27, if some of those will drop off based on rule changes. And with the list I was provided the other day of the list, I think we had one consumer that may be at risk. But all the rest of them are all disabled individuals. So they're drawing SSDI or SSI benefits, and so they will be protected.
So it's probably the work requirement that
Yeah.
that one person
Would be
the 20 hours a
requirement
week.
that's coming.
And through that partnership, we're maintaining communication with people come and go from, especially CCS. As we are approaching these timelines, talk with Diana's team and, okay, when is their next renewal date? And how do we assist that client to make sure they're staying on top of that and getting that process done in a timely way so they don't lose coverage.
Because we don't
Because it
get paid,
happens.
and we don't get paid if they don't have coverage. So that's very important for us.
So just trying to understand.
Once again, Tanya, I want to congratulate you. I think it's a huge decision in the right way.
Thank you.
Just trying to understand a little bit as far as the numbers that you presented. So $4 million, that's Wisconsin Medicaid that would come into Polk County.
Yep.
And those $4 million are used on 169 people.
Yep. Behavioral health and substance use services are not cheap.
Okay. I just want to make sure I was understanding correctly. Like,
But that also,
It costs more to put them in jail or prison.
Or put them in Winnebago, right?
I mean, truly, it's just not something I was even had a grasp. That's, I just trying to get and granted, that's only through third quarter. So there could be, just quick math of, fourth quarter being
projected per year. However, go back to the why we're doing it slide. The rate setting is critical.
Sure.
So we will have more control of that rate setting.
Right.
That I believe will
Could help us.
some
I just, like I
savings.
said, it's honestly just, I had no idea. So
Mind-boggling.
it is just mind boggling.
Get my calculator out here.
And we monitor very closely, cost per consumer per month, through reporting. We worked really hard, 2 years ago, to really focus on the amount of services that consumers are getting and who was paying those as well. So.
Million.
Our number one expense used to be transportation. I think it still is, but it's in line with the rest of those consortium counties, because they can transfer from Ross County all Polk County. It's
reimbursable.
And they get reimbursed at their provider rates. So if my rate is $200 an hour to provide therapy to you, I get $200 an hour to drive to see you.
Yeah.
And that's an area of focus we're hoping to really kind of look a little bit closer at with having that internal control of rate setting.
Sure. Kudos.
Thank you.
Pardon me?
22,000, that's
Yeah, 23.9.
23 now.
Yep.
Your cancer, what it costs.
Yeah.
It's
expensive.
Things cost a lot. It's something I just wasn't aware of. So I just wanted to verify I was understanding.
Blow your mind.
That's good.
Yeah.
Okay,
Any other questions?
if there's no other questions, I can give a legislative event report.
Okay.
We didn't have one, however, I promise. In 2 minutes or less, I connected with a couple of other counties, St. Croix and Pierce, about getting those legislative events together again, like I had
Yes.
mentioned last month, I think. And they are willing to explore that with us. So we will work together to get that roundtable back up and running again.
I think that was just huge, for people working together. I hope we get that going again.
Yes, yes. Well, they were all very enthusiastic about it, so
Good deal.
that's what I have. I don't know if Supervisor Bonaparte has anything, but I'm done.
John, you got anything for us?
No, I'm not, just, agree with, and I congratulate Tanya. I hope we get that local legislative, where we shared ideas and made a lot of progress.
Good enough.
The WCA legislative event beginning first week of February.
Okay. So we don't, so I'm going to move on then. We don't meet in February. So our next meeting will be on March 10th. What do we got in our work plan for that? March. Okay, so we have our Golden Age Manor Child Support and our Veteran Service Officer updates from 2025. Those are always really interesting. We have our accomplishments, a kind of year in review, a satisfaction survey, and our medical examiner is going to talk about scatter plot and CJCC. So that looks like a pretty full plate to me. But do we have anything else out there kind of pending that anybody wants to see or need addressed, or if something should come up in between now and then? Please contact myself or Tanya or Mo.
Is the resolution to move those other ones gonna be on the March?
That'll be added on
All right.
resolution.
Yeah.
The rest, for these one, clean print of it? Okay.
And March. We don't have anything else, then I would look for a motion to adjourn.
Move to adjourn.
I'll second it. Any discussion? No discussion, all in favor? Aye. Opposed?
I
And motion carried.
Mr. O'Connell, gonna have to come.